Erectile dysfunction, or ED, affects millions of men. And the truth is that it's usually a signal from your body that something else is going on. Hi, my name is Dr. Lamia Gabal. I am a board-certified urologist with an expertise in sexual health and medicine, practicing in Southern California. Today, I want to walk you through the 5 most common causes of erectile dysfunction. Understanding these can help you figure out what might be happening and, more importantly, what to do about it. So let's start with number 1, and it's a big one. An erection depends on healthy blood flow. Cardiovascular disease and poor blood flow are a top reason why some people experience erectile dysfunction. When blood vessels become narrowed or stiff from conditions like high blood pressure, high cholesterol, or atherosclerosis, which is a buildup of plaque in the arteries, blood can't flow into the penis the way it needs to. In fact, the arteries in the penis are actually smaller than the ones in your heart. And in fact, sometimes erectile dysfunction shows up years before a heart problem does. More than 2/3 of men with coronary artery disease actually had erectile dysfunction before they ever had chest pain. And that's why in my practice, when a man comes in with ED, I'm also thinking about his heart. ED can be an early warning sign of cardiovascular disease, and that is something we take very seriously and that we will investigate if you haven't already done that with your primary care doctor. Number 2 is diabetes. Diabetes is one of the strongest risk factors of erectile dysfunction. Studies show that over half of the men with diabetes will experience erectile dysfunction at some point in their lives. Diabetes damages blood vessels and nerves over time, both of which are essential for normal erections. High blood sugar leads to increased oxidative stress, which then reduces nitric oxide, which is the molecule that relaxes blood vessel walls, and eventually nerve damage in the pelvic area can happen. The longer someone has had diabetes and the less controlled their blood sugar is, the higher the risk. If you have diabetes and you're noticing changes in your erections, that's really worth bringing up with your doctor. It could also be a sign that your diabetes management needs to be adjusted. Number 3 is low testosterone. Testosterone plays a key role in sexual desire and in the physical process of getting an erection. When testosterone levels drop, which can happen naturally with age or because of other conditions like obesity or sleep apnea, which a lot of people don't realize, men often notice a decrease in libido first, or sex drive, followed by difficulty with erections. Now, low testosterone alone doesn't always cause erectile dysfunction, but when it's combined with other risk factors, it can make things significantly worse. A simple morning blood test can check your testosterone level, and if it's low, there are treatment options that can help. Number 4 is psychological factors. This is one that doesn't get talked about enough. And as I frequently talk to my patients about, this is the biggest sexual organ that we have. Stress, anxiety, depression, and relationship problems can all cause or worsen ED. Performance anxiety is especially common. If a man has one bad experience, starts worrying about the next time, and that worry itself then becomes a problem, it creates a cycle that can be very hard to break. Depression is particularly important here. Research shows that men with erectile dysfunction have significantly higher rates of depression, and the relationship goes both ways. It can be a really vicious cycle. Depression can cause erectile dysfunction, and then the ED can cause more depression. And if you're dealing with stress, anxiety, or low mood, addressing those issues is a real and important part of treating erectile dysfunction. There's really no shame in it, and it works. It really works. And number 5 is medications and lifestyle factors. A lot of men really don't realize that the medications they're taking could be contributing to their erectile dysfunction. Some of the most common culprits include certain blood pressure medications, especially thiazide diuretics and beta blockers, antidepressants, particularly SSRIs, and medications like finasteride, which is used for hair loss and prostate enlargement, can also affect erections and ejaculatory function. Beyond medications, lifestyle plays a huge role. Smoking doubles the risk of erectile dysfunction compared to non-smokers. Excessive alcohol use, lack of exercise, and obesity are all well-established risk factors for having erectile dysfunction. The good news is that these are modifiable. Quitting smoking, exercising regularly, losing weight, and working with your doctor to adjust medications can make a real difference. Again, don't try to change your medications on your own. We want you to talk to your doctor about that. Now, here's what I want you to take away from all of this. Erectile dysfunction is actually very common. It is not something to be embarrassed about, And most of the time, it's very treatable. Not only is it treatable, but if we address it early enough, it can also be reversible with certain regenerative therapies. But more than that, it can be your body's way of telling you something important about your overall health. So, if you're experiencing erectile dysfunction, please talk to your doctor. A basic evaluation usually includes a medical history, a physical exam, and some blood work, things like blood sugar, cholesterol, and a morning testosterone level. These simple tests can uncover underlying issues that are worth knowing about. Every person's situation is different, and the right approach depends on your individual health history. So please don't try to diagnose yourself based on a video. Use this information as a starting point for a conversation with your doctor. And if you found this helpful, go ahead and like the video and please subscribe to my channel. Drop a comment below if you have questions or topics you'd like me to cover next. And thank you for watching. I'll see you in the next one.